Regarding the upper or the lower motor neuron involvement, it's for the upper motor neuron, the tone is increased, while in the lower motor neuron lesions, the tone is reduced. The power in both of them is reduced, and the reflexes in upper motor neuron are increased, while in the lower motor neuron it is reduced. Muscle bulk is almost normal in the upper motor neuron, while in lower motor neuron lesions there is atrophy. The Babinski is upgoing in the upgoing in the upper motor neuron, while it's downgoing, that is normal, in the lower motor neuron. The fasciculations are absent in upper motor neuron while they are present, and the clonus is present in upper motor neuron while it is absent in the lower motor neurons.